Hello, this is Dr. Gurr.
Hi, Dr. Gurr. My name's Mrs. Smith. I'm calling because I have a 17-year-old son who I think is in some serious trouble.
hmm
We just returned from our vacation at our timeshare in Aruba, and he was anxious and miserable the whole time. He just can't seem to get out of having panic attacks, get out of the house. He's not sleeping. He's not eating right. He's crying for no apparent reason, and he won't go back to school. I'm really concerned. He looks depressed all the time, and he really can't tell us what's going wrong. So I think he needs therapy as soon as possible.
Okay.
I spoke to my pediatrician and he gave me your name, and then I also called the school psychologist who also gave your name. I also spoke to some friends, and one of my best friends told me that you treated her son and you worked very well together and really helped their son. So I've called other psychologists and I've really gotten nowhere. Either they have no room or they don't work with adolescents, and I'm calling you as a last resort to help my son. Do you think you can take him on as a patient? Lessons 3 days a week, and that's a lot of my availability in terms of time to get my kids here, there, and everywhere. My dog is another one that's costing me a lot of money. This dog needs obedience training, and that's $60 for 30 minutes a week. So we really just have evenings or maybe a Friday or Saturday. Do you have anything that would work?
Well, I'm looking at my schedule, Mrs. Smith, and I have one slot left on Friday about 5 o'clock in the afternoon. And I'm sorry, I don't work at weekends at all. Would that work for you?
You know, that actually would be perfect. I'd like to take that Friday at 5 o'clock.
Okay.
Okay, can I just ask you one more question?
Sure.
I'm just wondering, how do you work with adolescents? What do you do? Do you talk to the parents? Do you talk to the kid? How does it work?
It's a good question. It's kind of tricky when you work with adolescents because you really have to get them to trust you. And now, from my perspective as a psychologist and a parent, I know adolescents don't always make the right choices. So I walk kind of a thin line with them. So I work with them, but I also let them know that, I have to speak to their parents, and there are things that we have to work out as a team. Of course, if they tell me something that's dangerous, I will have to violate their confidentiality to protect them. But as I said, kids don't really live in a vacuum. So I really feel I have to work with them. And I kind of get the kids to agree that there'll be times that I'll be working with them and their parents.
Okay. So should I bring my husband for the first session, or should I just bring my son?
Well, I'll take anyone who comes. But in the first session, what I do is I talk to your son first. Get him to understand the rules and get him to understand that I'm not going to basically get information from you behind his back. Then I bring the parent or parents in and I get information from them. And then I kind of bring everybody in and we talk about what our game plan is.
Okay.
So everyone gets a piece in that first session.
Okay, that actually sounds great. I think you're just what I'm looking for. I spoke to other psychologists and they did not work in the same way, and I'm very comfortable with what you're telling me.
That's great.
I actually have one more question I thought of while we're talking.
What's that?
Are you on any insurance plans?
I'm a provider for some insurance plans. It really depends upon which one you're on.
Okay, we have United Healthcare.
Not a provider for that insurance company, but I would submit your claims and you'll get back some portion of the fees.
I think I'm going to have to find someone who's on the insurance panel. Thanks anyway. Nice talking to you. Bye-bye.
Bye-bye.